Hello, everybody. This is Dr. Gita Mathai, and this is my Health Vibes channel. Today, we are going to talk about a problem which almost everybody seems to have nowadays, and that is hair loss. Now, most of us are born with some hair, and as we grow older, the hair grows more and more, and it continues to grow till we reach adulthood. After that, many people complain of hair loss. Now, a loss of 100 to 150 hair a day is normal. If the hair loss is more than that, then perhaps it needs to be investigated. Hair loss runs in families and is genetically inherited. 63 of the genes which cause hair loss are inherited, and out of these, 6 genes are inherited directly from the mother. So, if you have maternal uncles who don't have hair and who are bald, and in your mother's side of the family people have less hair, then you are also likely to become like that. Now, where each hair grows in a follicle, and what happens when we have hair loss is that that particular follicle dies and it is not replaced by a new follicle. So gradually the hair becomes less and less. In men, they get male pattern baldness, which means that the hair is first lost from the back of the head in a circular way. And in women, it is lost from the whole head, also where they part their hair, if they pull their hair very tightly, and it is a general hair loss on the whole head. Now, if you go to somebody and complain that I have a loss of hair, certain tests have to be done. You have to be investigated for iron, zinc, calcium deficiency, and to see whether your thyroid is all right. Diabetes also tends to cause hair loss. In the olden days, when people started losing their hair, they did not really realize, because when they were 19 or 20, they would tie a turban on the head, and women would tie their head in a dupatta or put the sari palo over the head, and they did not take this off even in the house. So nobody knew whether they had hair or they did not have hair. Whereas in foreign countries, people had used to wear hats mainly to hide their bald heads, but they had to take off the hat when they go into the house, and then everybody would see. Both men and women wore hats in the olden days. If you have been investigated and found to have no reason for your hair loss except genetics, then you can try certain medications. Minoxidil can be applied to the head in both men and women. It has to be applied twice a day for men and once a day for women. The minoxidil is available as a solution and as a foam, and it has to be left on overnight. Minoxidil makes the hair grow very, very slowly. It takes 6 months for the hair to appear. The hair is finer and softer than the previous hair. Many people don't wait for 6 months. They get discouraged and they go searching around for a miracle cure. Some tablets also work for hair loss, like finasteride and spironolactone. But the problem is these tablets have to be taken in the correct dose, have to be taken under medical supervision, and women have to be careful, especially if they're planning to become pregnant. Many other treatments have arrived for hair loss now. Hair transplant has become a very common and almost routine procedure. Hair is taken from areas like the back of the head or the thigh where there's plenty of hair, and micro patches or large patches are applied to the bald areas. The hair which grows after a hair transplant is very much like your natural hair, and it lasts and it looks good. It's not soft and silky. Whatever hair you have, whether it is your own hair or hair transplant, please look after your hair properly. Do not use harsh shampoos and chemicals to straighten and color your hair or to wash your hair. Once you have washed your hair, do not rub vigorously with a towel, but gently pat the hair dry. Do not use very hot water on your head. Do not dry your hair with the hair dryer on a very high setting. Put a towel on your head and apply the hair dryer on top of the towel. If you are using shampoo, you don't have to put a lot of shampoo to get a lot of lather. Take a 1 rupee coin size of shampoo, add 30 ml of a non-greasy hair oil to this and 30 ml of water. Mix it well and do not apply this to the scalp, but apply to your head of hair so that your scalp is not disturbed in any way. All chemicals are detrimental to hair. This is hoping that all of you will have a good and luxurious growth of hair and will maintain whatever you have. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe and press the bell button. The same content is available in Tamil. Thank you.